Recent months about federal stimulus money, plenty of numbers and some of them very large. What often gets lost is how it affects the individual. One example today was a graduation for a training program funded by stimulus money. It's run by the anti-poverty agency ABCD, and it's known as the Community Health Worker Initiative. We'd like to welcome one of the graduates, Gail Williams, and the director of the initiative, Kenya Elisa McLaren. Thank you both very much for being with us.
Thank you for having us.
Gail Williams, talk about your story here, because I guess this is, the kind of story we were hoping we would hear about stimulus money that is helping people who've been hurting from the economy.
Yes. I was a guidance counselor, and I was in a provisional position, so of course that's
guidance counselor for which?
Boston Public Schools. And because I was one of the last hired, of course when the budget was cut, I was let go. So I was unemployed for a number of months, and I was going to career fairs, job fairs, and I came across the Community Health Worker Program Initiative. And I went for an informational session. I did some follow-up, and eventually I was accepted into the program.
So what is your next likely work going to be like?
I'm hoping that I can get something as a caseworker. I think that would be a good fit for me. I have done other work in human services, such as I was a social work intern for DCF, so I'm hoping that I can get something along those lines.
Tracy, can you, Elisa McLaren, about the kind of people who've been signing up, are these all people who've been out of work, people who've lost their jobs?
Well, actually, Chris, we've had a wide range of individuals who've come to the program. We have many who are fairly young, in their early 20s, who do not have work experience. So this was truly a career exploration program for them. Then we have the other end of the spectrum, a mature worker, 65 years old, who, again, having been affected by the economy, also came. So there's a broad range in the experiences.
The category here for this program is community health worker. Explain what kind of things that could mean.
Okay, a community health worker is an umbrella term. So it encompasses different job titles, job descriptions. So it could be an outreach worker, a youth worker, an educator, promotores de salud, someone to help educate and inform the community.
Why are those jobs important?
Well, as you know, you've seen healthcare statistics. They're very important in reaching individuals in the community, and having someone who is culturally appropriate to bring the message helps in increasing access to healthcare services and education information, as well as helping to reduce the health disparities we see overall.
Gail Williams, talk about what you've been doing since you've been in the program. I understand you've been working at a community agency?
Yes, it's actually a shelter for families, but while I was in the program, we had some wonderful workshops and seminars. We had leadership training skills, community organizing, things that will be useful when we go out into the field. What
did you learn from your internship, would you say?
I've learned how to deal with families who've been displaced, probably a lot of them through the economy, that they're out of their home, but they're in a home setting, and to be empathetic towards them, and not treat them like they are in a shelter.
I mean, imagine it requires a lot of patience, because people are going to be asking you serious questions, and you're not going to have all the answers right away.
Right. And when I don't have the answers, there are other people at the agency who are supervising me who do have the answer. So, if they come to me and it's something that I can't answer, I will, refer them to someone else.
Coming back to Kenya Elisa McLaren, leadership, you don't automatically think that a health worker needs to be a leader, but in a way, that's also important. Explain why that is the case.
Well, the community health workers are really the advocates for others who may not have the voice or know how to navigate for the services that they need. So part of our training is comprehensive, but we want to not just educate the graduates on different health issues or health topics, but we want to empower them to go out, to be proactive, to advocate for the individuals they're working with, as well as for the community as a whole, and even for themselves personally. So we take a holistic approach in this program.
By the way, what about follow-up? Now that they've had the training, maybe they need some more help finding some potential jobs.
Yes. So I have a job development team at ABCD that works with us, and once the training officially ends, that's not it. The students will continue to work with us. They have all previously been assigned to a job developer, and they will meet with them, continue to do job searches, continue to do their job readiness seminars, and we will even allow them to continue in their internships paid under ARA while they are seeking unsubsidized employment.
Gail Williams, what about your ability to devote the time to this and to feel motivated all the way through it? Because you've been through all these setbacks. People in the family, they've been supportive?
All of my family members have been supportive. They've encouraged me. They've helped me out when I've been in a pinch if I needed child care. So, yes, they have been. That's
part of what it takes. And we should mention, Kenya, Elizabeth McMurrin, one more time about how people can find out about this program. Is this still going to be ongoing and I guess also without charge to people?
Yes, it is without charge. Again, it's funded under ARA. The next cycle for our training program is scheduled to begin on June 3rd. So we've actually enrolled all of these students for our upcoming cycle that begins in June. But if anyone is interested in the program, there are 3 other new career areas that ABCD offers. So they have medical office training, they have elder services, and early childhood education. And those are all offered under Learning Works at ABCD.
All right, thank you very much for being with us.